Hi, I'm Jillian Gilchrist, Director of Health Professional Outreach at the Connecticut Coalition Against Domestic Violence. Intimate partner violence is a problem that impacts numerous women in the state of Connecticut every day and every year. On average, between 12 and 16 fatalities happen as a result of intimate partner violence. And in the last report that was done by Connecticut's Fatality Review, all but 2 of those women who were murdered either had an infant at home or were pregnant. And so we know that women face this crime at disproportionate numbers to men. And so that's why it's so important that OBGYNs screen their patients for intimate partner violence. We also know that the health consequences related to intimate partner violence disproportionately impact women. And so women who experience intimate partner violence are at increased risk of unintended pregnancy and STDs. There are some abusers who equate birth control with promiscuity, and so they won't allow their partner to use birth control, or they'll force their partner to have sex without protection. We also know that there's increased violence during pregnancy, and so it is imperative that a healthcare provider screen their patient. That's easier said than done, though. It's one thing to know why it's important to do the screen, but it's another to be faced with your patient. And so here are some tips and tools on how you best can screen your patients for intimate partner violence.
As part of my social history intake, we're asking some very specific questions that are part of our electronic medical record in the social history category. Does your partner physically hurt you or threaten to hurt you? No. I make that clear to people. Whatever you share with me stays private until you're ready to, explore options.
We screen for intimate partner violence every time a patient comes through our doors.
It starts with the clinic assistant. They do a lot of the initial screen, and when anything is brought to us that there's a red flag or there's concern, then we do more of a history.
Her partner pushes her a lot, and she kind of gives in somewhere. I believe that she believes this is normal, and that's a red flag for me because that's not normal.
They're very scared, they're very nervous. Sometimes they're on their phone a lot, worrying if somebody's going to be finding out what they're here for. Does he watch your text? And little by little we get a picture of someone who's in an abusive situation. My partner won't use condoms. Why won't your partner won't use condoms? Will you ask him to use condoms? No, he won't use them and I can't ask him to. That's a flag.
We have so much that we already are expected to do as providers in a very, very short amount of time. But my belief is that maybe someone's not ready to disclose to you the first time or the second time or even the 10th time, but maybe it's the 11th time that they walk through your door that they trust you and they feel like they finally can.
I make it very clear up front, I'm not the expert in intimate partner violence by any means. I look at it much like trying to help a patient with substance abuse. I'm not necessarily the person who can help you, but I know how to get you to the person who can.
I have found the best way to do this is to actually have them make a phone call here to the domestic violence line, because if you give somebody a phone number, you don't know what happens when they leave. Plus, people check their phones. Their partners can check their phones.
I have a patient I was wondering if you could help me with. And I want to put something in her chart, just a little flag or note that we need to follow up on this the next time she comes.
You have to know what steps you're going to take and how you can help this person.
What many health providers don't know is that you can actually get reimbursed for doing this screen. The Affordable Care Act made the screening, assessment, or referral for intimate partner violence a part of preventative care. So you can use a preventative code and get reimbursed. That said, you're going to have to document that you did the screen. That's important to do for any healthcare provider. And so documenting that you've done the intimate partner violence screen, you need to be careful of privacy. And so some providers are creating a separate case file or using a privacy setting on their electronic record system just to ensure that that documentation is kept in a private place on that patient's chart. I also sometimes get asked, if we do the screen or we do the screen and then something happens to that patient, are we held liable? I think that's why it is important to have it documented somewhere that you did the screen and made the referral. You play an integral role in keeping your patients healthy and safe, and so we hope that you will do the Intimate Partner Violence screen, document that screen, and make your referral.